I'm going to go ahead and turn it over to Joanne to kick us off.
Hi, everyone. Thanks for joining. I know this is your lunchtime, and I appreciate you spending time with me. I'd like to give you a little information about me. I'm an advanced practice nurse. I've been a nurse for over 50 years, a long time. I'm 75, and I started doing this about 20 years ago when I ended up having some health issues with mercury toxicity. And I essentially just started looking at nutrition and essentially back then there was not much, but there was some basic information. So I became involved then. My clinical experience has been as ICU nurse, ER nurse. I was in med surg because back then everyone did med surg. I did some psych and I did a trauma program. I was the director. As far as teaching, I taught at North Carolina and Maryland. As far as administrative, I did 10 years at ANCC, and in that role set up all the educational programs for all the certification exams. So I know that material pretty well, but it's old. It's like 8 years old at this point. And then I'm going to share with you some 21-day Kickstart programs, and I've done those for many, many organizations, including ANA, Indiana University, where I live now, and many community groups. So I'm going to be using that information. My goal for today is just to give you information. You might think some of it's okay. You might disagree with some of it. You might think, oh, this is interesting. I'm going to share it with patients. But my goal is just to give you information so you can make a decision for yourself, because I think there are two critical things you need to know. One, you need to understand where you are in the process of change. And then when you work with your patients, where they are in the process of change. And you also need to know why you're going to do this. I mean, as we all know, making the change in food is just really, really difficult. So you need to know whether you're doing it for your health or helping your patients for their health. You're doing it for animal farming to decrease that, or you're doing it for the environment. My hunch is most of you are here focused more on the environment. So I had some trouble getting slides up. So Kira is going to help me with the slide set. So I'm really appreciative. So next slide, Kira, and we'll do objectives. So the two objectives are identify 3 major food groups in a plant-based diet, and the other one, list one transition you could make in your organization or in your community, and it could be any one of your communities, to integrate a plant-forward nutrition approach. Next slide, Kira. So I don't know whether you really thought about it much, but there are actually only 3 types of food. We've got animal food, we've got processed food, and we've got plant-based food. And so all foods essentially will fall into one of those categories. In the next slide. So animal food, I think you all know what are the things that animal food involves. Essentially anything made from animals. Sometimes people aren't aware that honey is actually an animal food, but all the others I think you're very aware of. The next slide. So these are foods with animal products in them. And again, you might not be familiar with them, but all the bagels you get from Einstein's, McDonald's, Lender's, and a lot of the other brands, they all have a softening agent, the cysteine. And that is used in all the bagels. And it's from human hair or poultry feathers. And again, it's a small amount, but it's in there. Beer and wine has isinglass in it. And that's like a gelatin-like substance. And it comes from fish. Jello is gelatin, we all know. Peanuts, especially the Planters dry roasted, has gelatin in it. Red candy dye has some animal food in it, and usually sugar has bone char in it. So again, it's just other ways that animal food is in the food that you're eating that you might not be aware of. Next slide, please. So the impact of animal food on the environment. This one, I think you all know because this is your specialty. So I'm not going to spend a lot of time on this because I think you all know it. But essentially, we're talking about the global greenhouses. We're talking about the methane. We're talking about the carbon dioxide when you're cutting down all the forests. We're talking about the emissions from the manure, from the crop residues. But it's all written down. And again, I think you know most of it. Next slide. Again, continued impact on the environment. We've got meat production Cows and sheep are a big one, as you already know. We already talked about greenhouse gases. The next time you're in the grocery store and you're picking up 2 pounds of beef, think about what that actually is translating to. It's essentially the greenhouse gas from 3 hours of driving or keeping your lights on for 3 hours. So every time you pick up 2 pounds of beef, which is really not much beef, or 2 pounds of pork, or 2 pounds of any meat, just sort of do the transition in your mind. Next slide. So what is processed food? And there's, I mean, I think the Department of Agriculture is really clear. It's any food that was originally in raw commodity, and it's been heated, canned, frozen, dried, cut, even washed. I mean, lots of people don't consider washed becoming a processed food, but the minute you're changing it from its natural state, then it becomes a processed food. Next slide, please. So what are the common processed foods? You're all aware of all of the processed foods. My hunch is you can give me a list of all the foods that are processed, including all the microwavable foods. So when you go in the grocery store, you've got a whole array of foods that are all processed. Unless the minute you leave the aisle that's fruit and vegetables, you're into processed foods. Next slide, please. And these are the highly processed foods. So anything that's got a lot of sugar in it, your ice creams, your desserts, most of your bakery products, any of your fast foods, those are really very highly processed. Next slide. These are your most unhealthy processed foods. And the World Health Organization has come out and said all the processed meat, all the lunches meat, all the bacon, they're all highly carcinogenic. And it just really concerns me. California actually is really much better than many states, but because there's a plant-based option in all the hospitals and the schools. But around the rest of the country, they're serving luncheon meats, they're serving bacon to kids at breakfast. I mean, the school lunch programs have really got a lot to be desired because we're really feeding kids very unhealthy food. Next slide. So what happens when you stop eating processed food? And last month, yeah, in the end of June, there was actually an international conference in London on obesity. And they said one of the things that is causing the highest level of obesity is highly processed food. So what happens when you stop eating all this food, you do lose weight for most people, unless you transition to other foods, but you reduce your bloating, you definitely decrease water retention, your blood sugar is better, you have more energy, and your gut biome is much better. But it is hard to transition out of highly processed food. So we'll go a little further. Next slide. So we're talking about the environmental impact of processed foods on the environment. And when you think of a processed food, you have to think of, okay, we're talking about packaging, we're talking about refrigeration. Once it's refrigerated and it's put into trucks, then we're talking about transportation. So it's really important to take a look at where your food is actually coming from. Is it coming from someplace in the States? Is it coming from California? Is it coming from South America? Is it coming from Europe? But taking a look at the impact of where that food is going and the whole processing portion is just really, really important. And the ultra processed foods are linked to more greenhouse gases than any other food. Next slide, please. So I just wanted to give you some information about some different food groups. So you've heard vegan, and essentially that's avoiding all animal products, but you can be a very unhealthy vegan because lots of vegans are eating processed food or highly processed food. The companies are really doing an incredible job at recognizing that people want, quote, healthier processed foods. So you go in the grocery store and it's amazing, all the labels you'll see that will say healthy, vegan, but they're all processed. So next category is vegetarian, and they tend to avoid meat and fish, but they eat a lot of dairy, cheese. Dairy and cheese are probably the bigger ones on vegetarian. The pescatarians, they don't eat meat, but they do eat a lot of fish. And the flexitarians, those are the ones who said they're primarily plant food, eat plant-based, but they do small amounts of meat in their diet, and dairy, and cheese. And then the Mediterranean, which really right now has got a lot of publicity and is focus for many people. They do focus on healthier fruits and vegetables. They do have fish, they do have small amounts of meat, they do have olive oil. It's really interesting how people have made the Mediterranean eating lots of pasta, lots of olive oil. And when you look at the basic Mediterranean, it's much more fruits and vegetables in a very small quantity of olive oil. Next slide, please. So what are plant foods? Now, these I think you probably know. We've got all your vegetables, you've got all your fruits, all your whole grains, all your legumes, all your nuts and your seeds. And that's essentially plant foods. Now, we do have processed plant foods. Next slide, please. So processed plant food are going to be your spices and your herbs, all your plant-based proteins. So you've got tofu, tempeh, soybeans, you've got all your unsweetened plant milk. So, I mean, in the past probably 3 years, we've got oat milk, almond milk, soy milk, coconut milk. It seems to me every time we turn around, there's another kind of processed milk coming out. And then we've got plant oils, which are the extra virgin olive oil. And again, these are okay. They're, we've got all the environmental issues with processed plant food, but on the whole, they're better than all the animal food. And next slide, please. So plant food and the environment. So the more plant food you can eat, you're going to reduce the greenhouse emissions, you're saving water, you're definitely saving cropland. As far as pollutants are concerned, they're not leaching out into the water and they're not getting into the soil, and you're decreasing packaging waste, which we all know is a huge issue. Next slide, please. So as far as Kickstart's concerned, this is a program where people get sort of introduced to plant-based nutrition. And I did the first one probably about 15 years ago. And I was working with an organization that their staff was concerned that they wanted to lose weight, they wanted to get healthier, but they didn't want to pay an organization that was coming in and charging them a certain amount every week. So it was essentially too expensive. And then the HR department, who was very supportive of the Kickstart program, was concerned about the costs for insurance, and they wanted to see their staff be healthier so they could reduce their insurance plan costs. Okay, next slide. So it's a free online Kickstart program with Physicians Committee for Responsible Medicine. And again, it's free, it's online, and you can do it you can start it anytime. And I'm actually on their medical advisory board. I do not make any money from them. It's all volunteer. So it's a program I highly recommend. And on the program, they give you menus, they give you recipe lists, they give you grocery lists, and they give you cooking demos, which is really helpful for many people. Next slide. And so when I've done the Kickstart program with other groups, I add a couple extra components. I usually add a buddy system, so someone always has a partner. I always did weekly support groups. I was available 24/7 for questions. And when anyone emailed me a question, I sent the answer out to everybody and didn't include anybody's name. And then one of the most important components of the program was to have lab work done. I really like the numbers and the data. And so having the lab work done, especially cholesterol, was extremely helpful. And that was the only one we did, was the cholesterol. Next slide. So some people think that there's just not enough food, that you're really limited what you're eating on a plant-based nutrition program. And I always want to tell people there is plenty of food. You can do cereals, you can do toast, you can do oatmeal, you can do blueberry pancakes. There's a next slide with more food on it. So you can do breakfast, you can do tofu scrambles, you can do bagels, tons of crushes, orange, pineapple, blueberry. There are tons of crushes, but there's lots and lots of food to choose from. And again, on most of the 21-day Kickstart programs, there's lots and lots of recipes included. Next slide, please. So this is for lunch and dinner. You've got veggie burgers, burritos, yogurt, hummus. My hunch is a lot of the food some of you are already eating is already included in this. And the next slide has even more examples of lunch and dinner. We're talking about chili, we're stews, hash, macaroni, stir fries. There's just unlimited number. And the websites they've given you at the end, they all have recipes. So you never have to go out and buy a cookbook, and you don't have to do anything specific as far as just doing any specific plan. You can use any of the books in the library. Yeah, there's just thousands and thousands of recipes. Next one. So the results in the lab work, this was always very, very telling. And one of the reasons I really like having lab work. One of the groups we had, the participants had an average drop of 24 points of cholesterol in just 3 weeks. And then we had 3 people who had drops of 59, 49, and 42 points. And these are drops that you would love to see on medication, but you don't see them. And so this is just on food where we've got the tremendous drops. It's really important, and I do this in all the 21-day Kickstart programs. I always tell people, if you're on meds, make sure you let your healthcare provider know, because many times you're dropping very quickly and your meds need to be adjusted. There's some programs that are inpatient programs that they actually take people off the meds right away because it's just much more dramatic and their numbers are higher. So they're really monitoring extremely well. But I've seen many people decrease their meds or come off their meds, primarily for cardiac and diabetes. Next slide. What were the 2 hardest to give up? This was really interesting because I had my own bias, what I thought was hard. But when I did the survey with people, most people thought cheese was the hardest to give up. And it's really interesting because, probably 5 years ago, the cheese substitutes were really not very good. I have to say, they were not very good. But now, in the past probably 2, 3 years, the cheese substitutes are getting much, much better, and people are really liking them. The second hardest to give up was fish, because everyone thought fish was really healthy. But we're learning more, and since your environment is more your specialty, more and more that fish have a lot of problems with the chemicals and the plastics involved in them. And then the third was, as you would imagine, ice cream, yogurt, chocolate. Now, for yogurt nowadays, there's so many. There's soy yogurt, coconut yogurt. So there's so many yogurt substitutes we can use. Chicken was a big one. Milk. People aren't doing as much milk, and people are already decreasing their beef, and lots of people weren't eating pork. So that was down. Next slide, please. So the reasons people thought the project was successful, and I did this multiple times. Number one, and the biggest one, was people were able to see their change in their blood work. Having that data is so important, that if there's any way, if you're doing a 21-day program with someone, or John McDougall has a 10-day program on his website. And again, it's free, but it's not interactive. But anytime you can get people to do blood work there, especially cholesterol ahead of time, it's helpful. It was successful. There were lots of recipes. I gave people lots of websites for recipes. They got emails from Physicians Committee for Responsible Medicine. There were lots of menus. So if you didn't want to cook, or you didn't know how to cook, there were cooking lessons, and there were lots of menus. We gave people a lot of support. Like I said, I was available 24/7. People could email me with any questions. And for the faculty I was working with, they also found that they were helpful. And then the other thing I did a 90-minute kickoff in the beginning of the 21-day program. So people had a basic understanding of what this was all about. I gave them some research, especially in heart disease, diabetes, cancer, and some other chronic diseases. So people had a better idea of what the research was behind it, because I think that's really important. Next slide. So the process of change, and this is where you are, and this is where your patients or anybody you're with is. So it can be really frustrating sometimes to be really excited about plant-based nutrition, and people around you are just not very excited or not interested. And I always remember the process of change, that sometimes that's just not where people are right now. I've had many, many people come up to me and 3 years, 5 years later and say, Joanne, I remember you presented at a conference on this, and I just didn't think it was very relevant, or I didn't think it was very important. And now I get it. I absolutely get it. And so that's the important thing, is that people get it when they get it. And you might be sitting here thinking, well, I'm not going to make any changes now. And then other times you might be thinking, okay, I'm ready to jump in. So just you need to give people space on letting them get it when they get it. And always also remember that people, when they get it, lots of times then become um, they sort of want to spread the word to everybody, and they get really frustrated because other people aren't where they are. And again, I always remind people, people get it when they get it. And just because you start doing plant-based forward program, you might have slips, and that's okay. Everybody has slips, and you might be 80%, you might be 90%. Anything will be an improvement. It will help the environment and will definitely help animals. Next slide, please. So moving forward, what are the things you can do? In nursing, we have nutrition in our undergraduate nursing programs. It would be great if we can get faculty to put plant-based nutrition, and that's PBN, into the nutrition courses. That would be a really big step for education. For advanced practice nurses, they have prescription pads for writing food and nutrition information. So when they write a prescription for medication, there's another prescription pad to write for food or nutrition. Joining the national plant-based organizations, there's the American College of Lifestyle Medicine, and I'm going to give you the discount for student membership. Physicians Committee for Responsible Medicine is free. They have a nurses group, Nurses Nutrition Network, that I started with them back in 2010, I think. And they have meetings usually 2 or 3 a year. And then it's really important to get support, whether support from your colleagues, support from your family, but you've got to get some support, because it can be really lonely and you can feel isolated if you don't have a support group. And then if you have colleagues, talk about joining a group within yourselves. That would be a really help for each organization. I know I presented at several organizations where the nurses got together, and they were the ones who started talking to the hospitals, talking about the schools, and they got together as a group. Next slide, please. So what can you do now? Number one, you can organize your own 21-day Kickstart. As I said, it's free, it's online. You can start anytime. It's available in multiple languages. You can do the McDougall one, which is 10 days. You can request healthy food and meetings. You know, rather than donuts at meetings or bagels, ask for some healthier food. Lots of times you could do an oatmeal bar in the morning for a morning meeting, and you could have raisins and nuts and fruit. And it would just be a much healthier option. And again, you're role modeling, but you need to ask. I remember one of the nurses once said that she went to an award ceremony and all they had was sugary foods. And I said, well, what could you do? And she said, well, I don't know. And I said, well, you know what? Why don't you go to the people who were organizing and they just explain that you'd like to have a healthier option. And she did it. And sure enough, the next time it was half and half. It was half what I call junk food, and then half much healthier food, including like granola bars and healthier snack bars that weren't filled with sugar. One person can really make a big difference. Take a look as far as restaurants are concerned. When I worked at ANCC, when I first started there, they knew I was plant-based predominantly, and most of them weren't, which is absolutely fine. But when we traveled a lot, always took a look at the restaurants, because I always knew ahead of time which restaurants we were going to. But I always took a look at those restaurants and see what food I was more comfortable with, and I would probably order. So when we went, it was never an issue of like, oh, you know, they're waiting for me to order. I always knew exactly what I was going to get. And there were always options, because you can always get sides if you're not going to get the main dish. And the other thing you can do is you can start meetups in your organization. You can do it outside in your community, but I'm sure you're all familiar with meetups. But it's really important if you're having a meetup to support a plant-based restaurant. I always like to support plant-based restaurants going out, no matter where it is. I want them to be able to be successful. Another thing nurses can do is to show some movies. Have a movie night, a movie afternoon, a movie during lunch. And if it's an hour and a half movie, you can break it down into 2 segments. But there's so many good movies out there. Most of them are free. Code Blue is really, really good for healthcare professionals because the doctors talk about the influence of nutrition in medicine and how it's such a problem, and it so relates to nursing. It's an easy thing to understand. One of the movies I encourage you to eat before the presentation, this presentation, was Eating Our Way to Extinction, which is an excellent movie. It's relatively new, but it really talks about being plant forward and the animal issue, the environmental issue, and the health issue on food. Another thing you could do as far as nurses is to have monthly potlucks. And we did this at 2 organizations I worked at. Because again, nurses don't, well, not only nurses, general population tends not to have an idea of how broad recipes and menus and food opportunities are. So when you're getting together for a potluck, you can see a wide array. And sometimes people have asked me for recipes. And so I'll have a whole list of recipes, and it just depends on how elaborate they like to cook. But lots of times I'll have recipes for them. Next slide, please. And so some of the other plant-based programs, I told you about PCRM, and then John McDougall and Mary McDougall. Actually, Dr. John McDougall just passed away about 2 weeks ago, which was very, very sad. And we're sorry to lose him. I actually did all his continuing ed for all his programs for nurses back in 2010, 2012. But he has a lot of great programs, and he has a free 10-day program. And then his wife Mary's a nurse, and she has hundreds of recipes. They're all free on their website. Forks Over Knives is another really good organization. They have lots of recipes. They have testimonials. They have research, and it's all free. Just go in, sign up to get their emails, and you'll get it. A program that I have done that I have no financial investment with and I don't get paid for is the Rochester Medical Center. And that's run by Dr. Ted Barnett. And they have a 15-day program that's online. That's $99, but they do a lot of interaction with patients and a lot of medical information and lots of support. So if you have a patient or a family member or you, if you're interested, I would highly recommend that program. It's just a really, really good program. And again, I don't make any money from it, but I know I went to the program just so I knew I could feel comfortable recommending it. So that's a good one. If someone's looking for an inexpensive program that gives you lots of hand holding and get you through the process. The next slide, please. Okay, so the movies, I've given you a whole list and resources. Read as much as you possibly can. There is so much information out there, and I know nurses are pretty swamped with information, but there is plenty of information out there. Know where you are in the process. Know where you are, know where your patients are. Again, my goal for this presentation is to give you information. And I feel as nurses, we need to give patients information. Whether or not we're actually doing it, it's fine. You don't have to be doing it, but you do need to let patients know that there are options for them. And there are lots and lots of resources. So if you decide you don't want to be a resource for them, have a list of people who could be a resource for them, because it's just really important. My concern has always been that we withhold information, and I really think it's important to give people information. They need to know that heart disease can be prevented, it can be reversed, diabetes can be prevented, it can be reversed, that there's lots and lots of resources out there, and develop a community network is really important. Next slide, please. So being the leader in your organization, Number one is take a course in plant-based nutrition. Dr. McDougall has one, E. Cornell has one. I've done both of them. There's actually, if you need CEs and you just want general information, the American College of Lifestyle Medicine has a 5.5 free CE course, and I've given you the link. And that came from the White House conference back in 2022. So it's open to anybody. So anybody can take that course, and you can get 5.5 free CEs on it. And it's all on nutrition and lifestyle. Another thing is to be a leader in your organization, get a group of colleagues together. Again, it's really hard to do this by yourself, but if you're in an organization, see who else is involved. Sometimes dietitians are interested, physical therapists are interested, physicians assistants are interested. There actually can be a larger group, and you don't have to be doing this by yourself. And then talk with leadership on how they can support your choices, food choices. And sometimes it's just having a plant-based option at each meeting or at each conference, but having lots of options. It's really interesting. When I started with ANCC back in 2004, there really, as far as conference food was concerned, it was usually chicken, it was a piece of beef, it was potato, it was usually green beans or peas, and it had gravy floating all over it. And now food is much, much different. People are much, much more health conscious. What is interesting is usually on conferences, they give you an option of a vegetarian option and people don't choose it. But when they get to the conference and see what the vegetarian option is, then they want it. So many conferences now, in order to make sure they have enough vegetarian options for the people who order them, they give you little tickets or somehow identify you as actually having ordered a plant-based meal or vegetarian meal. So they make sure they have enough for everybody. Next slide. So making the transition, what do you need to do? Number one is clean out your own cabinets. Now, if you've got a lot of animal food there, I would give it away. Give it to somebody to use it. I would not throw it out. I mean, don't give it to someone who's trying to get healthier, but I would not be throwing food out. You've got shopping lists. When it comes to recipes and foods, take a look at the foods you're presently eating, because lots of times we're just tweaking them and they can become plant-based, especially if you're in a family and there's certain foods your family really likes. Definitely take a look at how you can tweak them to become more plant forward. As far as recipes, I've given you lots and lots of resources for recipes. And again, always, always have a support team. It can be really lonely and really isolating to try to do this by yourself. You can do it, but it's really, really difficult. You've got all your family, you've got social situations. Yeah, it can be challenging. So always get a support team. Next slide. So decreasing sugar is really, really important. Decreasing sodium in processed food. So just start reading labels. Decreasing your fat, trying to look for 3 grams or less in any of the processed food, and decreasing your oil. If you've got any heart disease, oil is just really problematic. Next slide. Changes to make at home. Again, identifying vegetarian meals you already eat and you like. Think of recipes you can change. Get cookbooks from the library. Again, I don't recommend for the first 6 months buying any cookbooks. There are plenty online, there are plenty in the library. And the other thing that's really helpful for many people, and they've said that they've learned a lot about themselves in the process. For a week, forget about anything plant-based and just take a look of writing down everything you eat for a week so you can see where the problems might be. This can be extremely helpful for you to do, and you can have a patient do it. There's a survey online. It's called 4-Leaf Survey. And it helps people. It's a quick survey, takes maybe 2 minutes, but it helps people identify whether they're really eating enough fruits and vegetables, proteins, nuts and seeds. And you can do it yourself. I usually have people do it ahead of time, and so they can see where they are, but it's a great little survey. But if you can do your own menu plan for a week and take a look at what you're eating and what's going to be a challenge for you, that's really helpful because many people are not going to do this overnight. They're going to, like I said, I learned about this 20 years ago and it took me a couple years to get to a point where I'm like 80, 90%. It just takes a while for many people. The people who can do it quickly are those who usually have a health challenge and they want to see change quickly, or the animal right people, because they really begin to learn more about factory farming and they do not want to be part of that process. PETA has PETA has a lot of videos on animal cruelty. Do not show those to children. They are not appropriate for children in my mind whatsoever. I never showed them at a conference. But if you really want to take a look at and learn how animals are treated, take a look at any of their films. But just be prepared because they are very upsetting. Next slide. Changes to make when you go eating out. There's a website called Happy Cow, and that's going to give you, just put in your city or where you want to go, and it'll tell you all the restaurants. They tend to be vegan and vegetarian, so they're not all plant-based. And lots of times they'll give you restaurants that are plant-based and have animal food. So at least you know that a restaurant's got plant-based options. I know I used Happy Cow a lot when I was at different organizations working because people would ask me for recommendations for restaurants. And so I always gave them two. I gave them one that was totally plant-based and was usually local and I wanted to support the smaller restaurants. But then I also gave them a restaurant that had animal food in it as well as plant-based because I knew sometimes they needed to take care of everybody. So I used Happy Cow a lot. As far as restaurants, knowing ahead of time, just take a look at their menu so you can figure out what they have that you can eat. I know I've got a luncheon tomorrow and I already know what I'm eating there. And then select foods from various food groups. So usually you can get sides, you can do nuts and seeds, you can do, there's usually plenty of options. People usually don't go hungry. Next slide, please. So I think this is one of the most important slides. What Ribble can you start now? So it's noon to 1 during this presentation. So after 1, when we finish, what are you going to do for the rest of the day? Are you going to make any changes today? Tonight, are you going to sort of think about it and say, okay, tomorrow, maybe I'll change breakfast, or maybe I'll change lunch, or maybe I'll do shopping and get some different foods. Maybe you're going to do this for a month. Take a look at doing it for a month, or maybe doing it for the rest of 2024. It's really important to think about when you're going to start making change. And based on the process of change, you might decide, you know what, I'm going to put this off for 6 months. I'm just not ready to change. And that's okay. Again, my goal is to give you the information. You can decide. And then where are you going to change? Are you going to make changes in your own home, which sometimes for people is more difficult? It's easier to make changes in your work or in your community, in any kind of group you're in. Maybe you're in a book club, maybe you're in a church group. Anything in your community would count as community. But sometimes home can be the most difficult for some people, and for other people, home can be the easiest. Next slide. So the American College of Lifestyle Medicine, I wanted to give you some information about them. Again, I'm a member. I do quite a bit with them. I don't make any money from them. They have a very active nurses group. And if you're a student, a doctoral student, undergrad student, any kind of graduate student, they have a waiver and you can get membership at a reduced fee. Just put in that code. And they focus on the 6 pillars. You've got nutrition, they're plant forward, their stress, exercise, sleep, risky substances, and social support. And they have specific education programs for nurses, which are really helpful. They have monthly meetings with nursing speakers, which everyone really enjoys. They have lots and lots of tools that you can use in different hospital settings. You can use it in doctors' offices. You can use it in nurse practitioners' offices. Nurses can use it in any kind of setting, but they have lots of tools and resources. Everything's focused on plant forward. Again, it's not 100%, but it's plant forward, and that's their website. Next slide. So here's some good websites. So Dr. Greger has these 3 and 4 minute videos that are really excellent. And you can put in any topic, an environmental topic, a healthcare topic, and you'll get all the videos. And then he's got all the research included. So if you want more information, he's got all the research included. Forks Over Knives is a great organization. Again, they've got lots of research, success stories. They have a good cooking course, and lots of plant-based news and recipes. There's the American College I just told you about, and they've got the free CE. The Physicians Committee, they have the Nurses Nutrition Network, and they've got things in multiple languages. And then Dr. McDougall has got testimonies. He's got the Starch Solution program. And again, his wife Mary's has lots of recipes. Next slide. Oh, here's some books. China Study's been out the longest and is excellent. For anybody who's got heart disease or cholesterol issues, Prevent and Reverse Heart Disease is really good. Starch Solution is excellent. Diabetes is another one for Dr. Bernard. Dr. Greger wrote How Not to Die, and then he has another book, How Not to Diet, for those who are interested in losing weight. Becoming Vegan with Brenda Davis is also a very good beginner book for people. And Dr. Bernard's Vegan Starter Kit is also very good. And there's lots and lots, there are hundreds of books out now, but these are the ones I sort of feel like for people getting more interested. If you want others, I can give you others later. Next slide, please. Oh, this is a book I wrote on plant-based nutrition. And I interviewed nurses around the country on how they got started. And it was really interesting because most nurses did not know, they were like me, they did not know about plant-based nutrition. And they found out either they went to a conference and they heard someone speak. Sometimes they got sick themselves. Sometimes a family member got sick, or a friend got sick, and they began to read some more. Sometimes they were just reading different articles and they began to read some more. But again, we're not getting this information. You're very fortunate to be getting this information at this point, because there are a lot of nurses around the country that don't have this information. I actually do some presentations for NP programs so that those nurses are getting that information now, because it's not in nursing schools, as most of you know. Next slide, please. Here's some cookbooks. Again, most of these are at the library. You do not need to buy these. I found that people, once they're into it for probably 6 months, then they have a better idea of what kind of food they like and what kind of author they might be interested in. Chef AJ does a lot of books and is very good. Is one of the authors, very good. Next slide. Oh, here's movies. So anybody who wants to watch movies, Code Blue is great for healthcare professionals. I think I explained that it's primarily about medical school, but a lot of it relates to nursing. Eating Our Way to Extinction, I've already recommended. Forks Over Knives. Anybody who's into being an athlete or sports, Game Changers is really nice and really helpful. And I think we're hearing more and more about vegan athletes. And then the rest are all available. Most are on Amazon, or some are Eating Our Way to Extinction is on YouTube. I think Code Blue is free. Forks Over Knives is free. A lot of them are already free. Next slide, please. There's a whole bunch of apps. These are the 4 major ones that most people are using. One's the PCRM Vegan Kickstart. Dr. McDougall has a mobile cookbook. Forks Over Knives has one, and Dr. Greger has his Daily Dozen. And that's a good app too. Next slide, please. And here's my contact information. You can email me with any questions. I'll be glad to respond. So are there any questions?
I'm just gonna pull up the chat here.
Okay.
Sorry about that.
No problem.
Let me see. Okay, so we do have some questions, and I'll also throw in the chat in just a minute the video that you mentioned, a link to the video. We do have a question about substitutes. So aren't cheese substitutes processed food, same for the other, I think, other vegan substitutes. So kind of what you mentioned in terms of
Mhm.
you can be an unhealthy vegan. Can maybe touch on that.
Absolutely. But as far as I'm concerned, we're in it's process. So let's sort of, as long as we're going forward. So there's the Impossible Meat and the Beyond Meat. I think it's the Beyond Meat has a lot of chemicals in it. It's not great. I think it's the Impossible has the most of the chemicals. The Beyond is a little better. But as far as I'm concerned, they're still better than beef. So I would go for heading in the right direction. And if you stay in the middle, still that's better than being at the end of eating all the animal food. You're still going to help the environment. You're still going to help the animals, and it's still going to be healthier than eating tons of junk food. We're not perfect, we're just trying.
Yeah. And then Barbara Sattler, who is one of the co-chairs of the Food and Agriculture Committee, who is not able to, she's in listening only mode, and she is on watching her granddaughter. So, but she put in a great resource from Healthcare Without Harm on plant-based diets, including how to help your hospital become more plant-based. Also, a comment about dropping cholesterol a pretty significant amount by going to 90% plant-based eating. Fear was my motivating factor. This is awesome.
That's actually
And
why I actually love doing cholesterol data before people do the 21-day when they do 20, because they have no awareness of how much their cholesterol can drop. And it's so much faster than medication. It's just amazing.
yes, and without the side effects that come
Yeah,
with
yeah.
medication. We have a great question for Tom, and this is kind of also my thinking too. Tom, I wonder if you could touch on around policy strategies and tactics. Mentions I see that Denmark is moving on carbon responsibility from farmers. I think the coalition proposal is 100 euros per cow. I don't know if you can touch on any of that. I know you gave a lot of individual or community level interventions.
Is that for me or for Tom?
That is for you. I'm sorry. That was
Oh,
from
sorry.
Tom. Tom's question.
Sorry, I thought Tom was. Sorry. So will you give me that one again?
Well, I read recently that Denmark is, I guess you can't drive very far in Denmark. So their attack on greenhouse gases is on farming. And so I think they're trying to have farmers be more responsible with sustainable stuff and what have you. But I think the takeaway in an article I read the other day was 100 euros per cow. And the article was too short for me to know what it was per sheep or chicken or whatever else they raise there. But I did catch the 100 euros per cow as their, whatever they call their government, their coalition government is thinking about doing.
I do think it's tough because this is their livelihood. Lyman, I forget his first name, but he's done some presentations, and he was actually a farmer who raised cows and talked about. Oh, I wish I could remember his first name, but I can't. His last name's Lyman, Lyman, and he's written some articles and published a book, I think. But he talks about how difficult it is to transition from raising cows and losing that income to transitioning to more plant forward and how to change a farm. And it was very good. I think he's now probably in his late 80s, because I think I think he was about 10 years older than I am. And so he late 80s, maybe 90. So I'm not sure he's presenting anymore, but he has done some excellent work as far as raising cows and the impact and making that change.
Well, it's not easy. I'm in Oregon, and so there's people who want to keep cutting trees down,
Yeah,
forever. And I think you said you've lived in North Carolina, so tobacco farmers have, had to decide what they want to do instead. So,
yeah. And
It-
chicken,
It's not easy. It's
it
not
is
easy.
not easy. It is not easy.
But, while it's not easy, it's burning up the world. So we can't
Right.
forget what it's doing.
Absolutely. And, people are buying those products. So another way of looking at it is if we can get people to cut down on what they're purchasing, that will have an influence. Because if people aren't buying the chicken and they're not buying the beef, we've seen that with all the major companies. They're all switching to plant-based milk. Some of these companies, they want to make money. And if plant-based products are going to make money, that's what they're going to do. It's processed, but it's headed in the right direction. But we've got to get people to stop purchasing. That's a beginning.
And Barb makes an excellent comment about how we need to subsidize farmers' income if we are asking them to transition on behalf of climate change, which is a great point.
Absolutely. Absolutely.
And we have a small enough group if folks want to unmute and ask a question. We have, 7 more minutes if folks want to ask a more detailed question, feel free.
Again, for me, the thing is it just beginning somewhere. Maybe you can just change your breakfast. Maybe you can change 1 day a week. Anything just to begin the process. And if you're not ready to change, it's okay. Figure out when you might be ready to change. But again, I've had nurses come up to me and say, Joanne, I remember you talking about this years ago. I just wasn't ready. And that's okay. They get there now. And they wish they had gotten there earlier, but I said, you get there when you get there.